Should we get? See how that works? I'm going to call this meeting to order. We'll get a roll call vote, please.
Milton.
Yep.
Stepp. McConnell. Deaton. Leaming. Mayor, we have a quorum.
Thank you. Looks like we're starting off the meeting with the approval of the Resource Committee minutes for April 19th. We have a motion? Second. We have a motion second. All in favor, say aye. Aye. Opposed, same sign. Ayes have it. We now have a discussion of the 2024 City of Branson Employee Insurance Selections. Oh, Haley, is that you? Come. Morning. No. And nobody can hear you upstairs.
Try again.
Hello, hello.
Testing, testing. All right. Good morning. So we're here to talk about our 2024 insurance renewal. As part of our due diligence obligation, we embarked on an assessment of insurance quotes for the fiscal year 2024. This was driven by the necessity to explore alternative carriers given an elevated initial quote from our current provider. We will discuss the findings that we found that were given to us, the competitive options that were found, in hopes that we're finding a fiscally responsible insurance coverage for the next year. Unfortunately, we did not receive any quotes for self-funding for the 2024 plan year. This was mostly because we had such a significantly elevated utilization of our plan. Our expenditures actually exceeded our contributions and still are. We're only 10 months in and we're spending more than we're putting in. We actually encountered a situation with two providers, United Healthcare and Cox, who opted to not even provide quotes for our fully funded insurance plan or even a level funded plan. So our claims are so high right now that we have providers that are choosing not to even provide quotes to us. So with knowing that, we will look at this again for 2025 if it makes sense. I don't know that we'll have enough of a good claims history even at that time to move to self-funded, but we'll continue on that path and continue working towards that being a goal. But this year just wasn't the year for that to happen. So unfortunately we couldn't do that, but we did get some great quotes from other providers. So I will introduce Charles Angel. Charles is with JTS Financial. There we go. He's the Vice President of Employee Benefit Programs there, our current broker, and he'll be going over our renewals and a quick discussion of where we're at and where we're headed.
Very nice. Welcome, Charles.
Thank you, Haley. I'll move this mic up. I'm just a little bit taller than Haley. So we have some familiar faces and a couple new faces. Good to see everyone this morning. I'll go into just a tiny bit more of a deep dive on kind of where we hit on claims. You know, obviously, as we discussed last year, self-funding is the goal. That's where we'd like to get. We had 7 or 8 very good years in a row at City of Branson where we never got even really close to that 100% mark. Unfortunately, you know, as you've heard me say before, we can't control claims. Sometimes these things happen. So we have, I believe, 269 employees currently on our health plan. So medical insurance carriers consider $10,000 the large claimant mark. So if they've spent at least $10,000 on someone, they'll consider that a large claimant. We have approximately 40 large claimants this year that we've already reached, which is about 15% of our base. That's just an unfortunate year. Claims-wise, we had some folks that got really sick, and then we had one driver especially that was over $300,000 so far this year. And the expected is between 325 and 575 next year. So that's really what kind of gave us a pause on this route. And as you'll remember, we are currently level funded, which is on a self-funded chassis, right? This was kind of our training wheels to get to self-funded. So 10 second in a nutshell on that. What that looks like is we capitated our risk. What we pay in what looks like a premium is the most we could possibly pay. If we have a bad year, we don't have to make anything up like we would if we were truly self-funded. On the flip side of that, if there was a surplus at the end of the year, we only got 50% of that. Given what we're looking at, I don't believe a surplus is in the cards for us, but that's kind of where we are. So we are somewhere in between right now, fully insured and a self-funded, traditional self-funded group. So, forgive me, guys, my age is getting the best of me. Oh, yes, this is actually great. So currently Gravy is the third-party administrator that runs our level-funded plan. I have no idea why they chose to call it Gravy. It's an interesting name, but they did, and they gave us some very good options last year. Due to that heightened utilization that Haley brought up, Gravy's initial proposal was a 14% increase in premiums. As carriers tend to do, as you go out and get bids and get the competitive marketplace going, which is what our job is to make sure that's happening, Gravy came down to a 10.2% increase, which is still quite high and not what we were looking for, but put us in a better spot with the other carriers, because obviously when one moves, they all start to sharpen their pencils. They don't all move, but usually when one moves, the others start to follow. Currently, we're also with Delta for our dental and our vision, and our base life and our voluntary life are through One America. The recommendation that JTS and the HR department has come to this year is for Cigna. It's also, let me back up. Cigna presented a comprehensive proposal offering a modest 1.5% rate increase over our existing 2023 rates. So on top of that 1.15%, do we have that in the new slide? Yes. That, I apologize, it's not on this sheet. So I want to go down to where that asterisk is by the 1.15%. They also offered us an administrative credit, so actually the rate is around 104% of what we're doing currently. That administrative credit that they've offered us of $146,000 brings it down to the 1.15. So what that means is on our first bill, there will be a credit for $146,000. So budget-wise, 1.15% increase is the number, okay? But I want to make sure that I'm clear with this board. I would rather have an actual 1.15% renewal than the 104% with the administrative credit. The reason for that is, as we go through this exercise next year, their starting bar will be 104%. So it's not really as good as that 1.15, but I'd rather have the administrative credit than not have the administrative credit. That's hard dollars, $146,000 that we won't be spending in January. So that's where we get to with that credit. There's an additional opportunity with Cigna to drop our health insurance rate by 1% if we bundle the medical with the dental coverage. So estimated annual difference there of $254,253.60. The Cigna's dental rates emerged as the most competitive bid. As you can see, there's about a $30,000 savings. That'll be split between the employer and the employees. I would say, I haven't looked at the actual math, but I would say more of that will go to the employer than the employee because we pay for 100% of employee-only dental coverage and not everyone elects family coverage. Vision, although Cigna's vision ranks did not rate as the absolute lowest cost option, the recommendation stands in favor of Cigna primarily due to its commitment to convenience and user-friendly for our employees. And, you know, it's been my experience that if we streamline, the more things we can streamline through one carrier, the less confusion there is for employees and providers as well. All right, so here's kind of a snapshot of the Cigna plan that's been offered. It's also a level-funded plan. So we're staying with the exact same plan design that we described earlier on that level-funded chassis, where we have the opportunity to receive a surplus if we have a good year, but would not be at any exposure for additional funding if we were to have another bad year. In network, This is very important to City of Branson, in my experience, that we have Cox and Mercy in network. Last year, when we were looking at Gravy, we had network options of both Aetna and Cigna. We chose Aetna because they had both Cox and Mercy. Cigna did not. In February of this year, Cigna was finally able to get that contract in place and offer Cox and Mercy at no additional charge. So in visiting with your employees over the years, I've found that that's fairly important. So I thought that was definitely worth a bullet point on here in my eyes. The co-insurance continues with the $0 copays for doctor and specialist, urgent care, generic prescriptions. Cigna tried to match our plan design with Gravy as close as possible. As you may recall, Gravy's slightly different, almost very different, but it has some slightly different thought processes on how many things to pay at 100% so that employees don't have to. Thought process being, make sure people are getting the little things done. There's no cost barrier there for the employees so that we don't hit those big things down the road. We'll get into in the spreadsheet in a little bit. There's a slight difference on imaging. In the primary care, imaging is still covered at 100%. Once you get into specialists like on Gravy, if I were to go to an ortho and they happen to have an MRI in facility, I could get that covered at 100%. With Cigna, any advanced imaging then goes to deductible and coinsurance. That's the main difference in the two plans this year. But everything else Cigna has tried to really marry up with Gravy, so there won't be a whole lot of change for employees if we move from plan to plan. Cigna has also committed to a $15,000 wellness fund for the city to utilize. We would work with Human Resources and Cigna. I believe Human Resources was considering a wellness fund in their budget anyway. And the great thing about this is the city wouldn't have to fund that budget, Cigna would. So if we want to have health fairs or several different things that we might want to do to promote wellness with our employee base, then Cigna foots the bill for that as opposed to the city, which $15,000 is $15,000. That's just another thing that goes out there that is kind of a soft cost that we were going to have to incur anyway. There's a free employee assistance program that Cigna offers with up to 3 face-to-face visits per need is how they state that. So I like that verbiage because it's not per occurrence, it's per need. So the joke I made for Haley was if my wife's frustrated with me about one thing, I might need it for these 3. And if she gets frustrated with me about a different thing, that's a new 3, right? So you can have a lot of face-to-face visits that way. And of course, it's unlimited telephonic. So that's at no cost to the city, which, as we all know, employee assistance programs have really grown in popularity and need, in my opinion, over the last 5 to 10 years. There's a dedicated 1-800 hotline for city employees for in the midst of treatment plans. We also will make sure that we interject ourselves in those situations if we can help. We never want to just hand an employee over and say, here's an 800 number. We'll be more than happy to facilitate those conversations. We see that as our job as your broker, to kind of help handhold people and make sure that if they have a prior authorization in place with Gravy or something like that, we make sure that's handled for them before we get to January 1st. So life insurance, this is a much easier conversation. Life insurance kind of is what it is. We look at the amount that the city pays for, and if someone passes away, that's what goes to their beneficiary. So it's very apples to apples with life insurance. We were in the midst of a 2-year rate guarantee with OneAmerica, which is great, but just to do our due diligence, we always put these things out to the market anyway, just in case. This is one of the better examples of just in case I've found. Transamerica came in with a 40% savings for matched coverage. To me, this is an absolute no-brainer. It's mirrored coverage, and the city's going to save a little over $20,000. So here's our overall savings, but with a caveat. The 1% dental credit on the medical is not included in this. So that would get our total savings to around $13,000. A few other things aren't in here either, the $15,000 wellness fund, some of the different things. We try to just look at hard premiums year over year, but even when we carve out some of the soft cost things and then the 1% savings by electing the dental because we aren't sure what the recommendation of the board will be, we're looking at almost an $8,000 savings for the city.
Some of that cost is employee savings, right?
Yes, it is. Thank you, Haley. Moving back, some of that, much like when we were talking about the dental, some of it's employee savings, some of it's employer savings. Quite candidly, by my math, more savings actually goes to the employer, because if you look at that life insurance, that $20,000, $363, that is 100% city savings there, because that's what's provided at no cost to all employees. So there'll be some savings for employees, but a larger savings for the city as well. Is that our final slide?
That's it.
I guess I talked too fast, but.
Oops, I pushed and I wasn't supposed to. Conditioning. Thank you for doing the extra work. Just to recap, like you said, the city had about 7 or 8 years of low claims. And so as we watched that over the years, there was several $100,000 difference between our premiums and our claims. So we started looking at what can we do to start the process of becoming self-funded. So if we could put a couple $100,000 a year away, we'd reach a point where we'd be better off self-funded. And so that plan made a lot of sense during those 7 years where we had savings, right? So according to Charles, we knew that could change, and it has changed. We made the decision based on the information we had. How does, Haley, how do our employees feel about this? Are they aware of these differences?
What do you mean differences? In the plan options? Or in
Yes.
the coverages?
Yeah.
Not yet. So we decided or went through all of this on Friday.
Okay,
So it's all very new, right? I mean, we're still getting prescription lists and provider lists to ensure everything is comparable. I mean, those are all coming in this morning.
Okay,
So
fair enough.
it's so fresh and new that unfortunately, no, we haven't had any opportunity to talk to employees about it.
okay,
Now, I can say that as we looked at the level of coverages, the only areas that we found a gap was in imaging, correct? So that was really the only place that people are gonna feel that in their pocket. Now, I mean, they're gonna feel that, right? That's your MRIs and CTs and all of those things. So they will feel a little bit of that, but as compared to a 10% increase, I
Oh,
don't.
for sure.
I don't know how to justify that in that way.
yeah,
Dental providers, so again, we were at 90-something percent, 98% of the local dentist or dentists in this area are covered under the new plan. So hopefully that very small percentage of people are willing to try someone new, if that's the case.
So Delta Dental and Cigna, no difference to the employee except the different dentist may be approved under one plan and not the other?
Correct, which should be a very small amount of people.
Okay,
And on the vision plan, we actually added in that your vision, your initial exam is covered at $0. So that's covered under the vision plan instead of under our medical plan, right? So we just added that layer in with it. So there was a tiny uptick in vision, but I think adding that in at a zero cost is half of the benefit there, right?
yeah.
Gets people to go, which is kind of the point, so,
Okay, so other than imaging, everything else is similar.
correct.
And let me emphasize, when I say everything else is similar, Charles, when you brought us this plan, the benefits to the employees was fairly significant, right? Zero cost for this, zero cost for that. So the plan really improved that you brought to the table. And so what we're comparing is a very good plan that you brought, right? And we're tweaking that.
Yes, sir. That's exactly right. This plan that we're talking about for 2024 is still much stronger from the employee standpoint than the plan we had in 2022, because it still has all those zero cost for primary care, for specialists, for that laundry list of drugs, right? Because we want people to take those maintenance meds. So,
Yeah, and I really appreciated that for all the staff at City, all of those visits where there was the $20 copay and the $40 copay and all that, those all went away, which even those are small dollar amounts, it affects a lot of people, right?
it can create barriers to care, which is the last thing we want.
That's exactly right.
Now, there could be, you know, as we go through this, there could be a prescription that was covered under a tier that's in a different, I mean, there might be a few little nuances like that
Sure.
that we haven't identified yet. But we'll work through those as they come up. And I mean, that's gonna happen anytime you have a change in carrier.
bet.
It's just part of the process, so. But fortunately, there's a hotline to help people with that. JTS is very willing to, you know, help people navigate through all of those problems as well. So, you know, I feel really confident in this move. You know, Cigna's a nationwide provider, so it's not, I'm not knocking Cox by any means, but it's not like it's a, you know, just small right here local provider that doesn't have networks outside of our region.
Yeah.
So that makes me feel good as well, right? That we have that expansion too if it's needed, so.
The only other change was HSA. Charles, do you want to mention the out-of-pockets for that?
I will. The family deductible on the HSA plan went up to $3,200 this year. Individual went to $1,600. So the major providers have kind of insisted that they're pushing their individuals from $3,000 to $3,200. They feel like there's a compliance issue there. It doesn't make a lot of sense to me, reading things on irs.gov, but Anthem provided us with the same thing, that they wouldn't give a $3,000 quote. They gave us a $3,200 quote. So that's a good call, Kimberly. Yes, the qualified high deductible health plan had a deductible of $3,000 in 2023, but the carriers are forcing us to a $3,200 in 2024. Gravy was not going to do that. They were going to maintain the $3,000 deductible for the qualified high deductible health plan. I suppose they read the documentation from the IRS under the same lens I did. But Cigna and Aetna know what they're doing. They have a lot of good attorneys on staff, so we're probably safer on the $3,200 side, to be candid.
And that was $3,200 for single and $6,400 for family.
Yes, ma'am.
Okay, so that's a difference, yeah. And did I hear you correctly? We're going to stay, that's so funny. We're going to stay on the gravy train. The gravy chassis, or no?
So, the gravy train, I'm going to start using that, Mayor. I like that. So, the recommendation would actually be to leave Gravy January 1st and move to Cigna,
Okay,
changing our third-party administrator from Gravy to Cigna. We would still be on the same plan design, the same self-funded
Okay.
chassis on a level-funded plan design. I should have communicated that a little more clearly. We're level-funded now. If we follow this recommendation, we would continue to be level-funded.
level funded, okay.
But our network and our third-party administrator would switch from Gravy and Aetna to Cigna and Cigna.
So our employees then, this is mid-October, they're going to go through a transition process like they did when we went to Gravy, right?
Yes, sir.
I don't know how much brain cells that takes, or how much, will you be communicating with a lot of employees, right?
Yeah, so we will have open enrollment, of course. There'll be electronic communications, we'll have in-person meetings, we'll have live calls with American Fidelity to set up your enrollment. So we'll do everything we possibly can to get information in their hands. They'll produce a benefit guide for us that has everything laid out for our employees, showing the costs, their coverages, you know, the providers that we're utilizing, all of that. So we will print cards between us, probably in-house. So some of that will come to us so that we'll be able to do things a little quicker, which is kind of nice, right? Sometimes waiting on the providers takes some time. So there'll be some things that we'll be able to do there. But yes, there'll be a ton of communication coming out to our team. And then support staff on the flip side if they don't want to talk to any of us in person.
So Charles and JTS, they help a lot with this transition process, with the information and,
That's correct. They'll help with the communication pieces. Enrollment will all be through American Fidelity and the HR team.
any issues with the timing? This is new, right? You just received this on Friday. I don't know if there's any more digesting you need to go through. Is what we're doing today is you're presenting it to HR.
Correct.
HR, then, you're going to ask for HR to make a recommendation to the Board of Aldermen.
Correct.
And is that on Tuesday's agenda?
It is not on Tuesday's agenda. We will have to go through contract management, right, to get everything approved before we can get on the agenda.
Okay,
So it will be very fast when it happens.
yeah. Should we be concerned about that? Because we're looking at what, the end of October then?
Right, the first one.
November 12th.
So our open enrollment is the last week in November, first week of December.
Oh, boy.
The first week of December.
And then that, we'll have the first week of December is open enrollment. That gives the HR team 3 weeks behind that to put all of the deductions and information into payroll for our first deductions to come out in January. It's pretty fast. That's typical for HR this time of year.
Okay.
Yeah. We block out our calendars for open enrollment dates for weeks.
I can just imagine. Yeah, you got to clear your schedule.
Yes,
Yeah.
we do.
We on the committee have questions?
Am I supposed to? Okay. Do I have to hold this a little?
Yes.
My only question is the big change with the imaging, because we just went through this with our son with a broken foot, so I know how expensive that can get. What did they have before, and what does it look like now?
Before, like
Like
currently what we have?
currently,
So
what is it with the imaging?
currently it's
And
included in your $0
so there's nothing that, okay.
Correct.
So
Now, year prior, it wouldn't have been that way, right? It would have been under your normal copay and insurance and deductibles and all of the fun things.
So going forward, is
It
that?
will be back to your copays and deductibles.
I'm just asking because I know that that can add up. I
It can.
mean, no matter how good your insurance is, the imaging can really add
It
up
really
really
can.
quick.
Now, we do have an accident policy, so if it was an accident-related imaging, right, you could elect that. That would at least put some cash dollars back in your pocket to help with some of that. But it's a voluntary elected benefit that's at the cost of the employee.
Is that an accident at work? Or is that an accident, your
No,
kid?
accident outside.
Anything,
Oh,
okay.
yeah. You break a bone, you slice your hand open, you puncture an eye, any of those things. Puncture an eye.
Any other examples you want to share?
No, that's okay. Good stuff. Can you tell that I have 3 boys at home? Husband that rides a motorcycle, you know, we might have some accident coverage in my house.
That is why I'm asking, because we have had lots of imaging the last
Mm-hmm.
year and a half at our
Oh,
house.
twisted ankles, broken, you know, whatever, fingers and things, yes.
Well, in the times we're in, I think it's acceptable. There has to be give and take, right? When we look at what inflation has done, just across the board, and medical seems to stay ahead of all that. So it is trade-offs, right? It
Correct.
sounds like you've kept the majority of what we have, with the exception of imaging and,
The $200 increase in HSA.
yes.
Yeah.
Yeah. Any other questions, comments?
Thank you.
Yeah, you're
I
welcome.
know that's a lot of work. And I mean, I know that's, I mean, a lot to look at. And I think it's a great option for the time that we're at right now with inflation. Just the fact that you're able to get the costs where they're at, I think that's great.
Yes. I didn't expect, I actually asked to budget much higher than that, because I expected an increase,
Do
right?
not say that when Charles is in the room.
He knows already. Well, the first time he came back, I was like, that is not in my budget. You got to go back. Like, nuh-uh. But, you know, knowing we were on a new plan and it was so rich in benefits, you're going to have an increase, right? People they feel like they can go. And that was the point. So the idea is that hopefully because we're doing these things, it pays off in the long run too, because people are doing the preventive things. So, you know, I did expect that there was going to be a large increase, just knowing that we had such a rich package. And anytime you're on a plan for the first year, right, they come in and want your business, and, you know, you get a little bump the next year. I just knew that where they came in was way too high for us to swallow, so,
Well, and factoring in our claims, right?
right. And it's also a good wake-up call for all of us, right, to be a little more focused on our health and wellness as an organization, so kudos to that 15 grand we're going to get.
Other questions, comments? Go ahead.
Yeah, I mean, it really is a good plan. I mean, when I'm out there, you know, in the private sector, and it's like, wow, this is still something that you can use to increase your engagement with the community when you're trying to hire.
Right.
Because it's like, whoa, this has got to be expensive. And that's where my mind goes, like, we open up our plans each year to our, you know, team and say, hey, would you rather have a $500 more copay, or do you want to pay the extra $20 a month to stay on this plan? Where does that sit right now when you guys are looking at that, where it's like, is the same, or?
Well, so we pay 100% of the employee cost. Not on all of the plans, right? But there's 3 plan options. So there is an option for us to pay 100% of your coverage. So it really, that conversation doesn't happen with them because we're going to maintain that.
Yeah, I'm looking for a job at the city.
Right.
So,
And you're right.
Great.
I mean, $0 copays is incredible. In the private sector, you don't see that very often. Like, you don't find a plan this rich in
yeah,
benefits.
every
so-
year with our team, we're having a conversation like we take more in deductible.
Correct.
We take, our copay goes from 20 to 30, like just to keep it at a rate we can stomach. So,
Yeah.
great job.
And that's
So
also
really
why we
good.
offer the 3 layers, right? So there's an option to have a lower deductible with a cost to the employee. So there is that option for those that need it or know they're going to have something large happening. So they can kind of determine that based off what their personal needs are and then what they can afford. But there's always an option for them to have coverage regardless. Like, that's always something, yes.
Yeah, great job. Next year, how do we plan to kind of tackle that 100%? I mean, do we look at, does the city offer like a cafeteria plan to now take in effect? Like we did that last year when it was like, okay, now we're going to have to increase our copay, but if we take a cafeteria plan and our team adds it in, they do get the tax saving, but now telehealth is still 100% covered. But yes, when you go to the doctor, but we cut out a lot of costs that way.
Right. So the city currently offers vehicles for that. If you're on the base or the buy-up plan, there's a flexible spending account available, which is pre-tax dollars for just this year. And then really, the driving force that would push people to the qualified high-deductible health plan is you get to have an HSA, a health savings account, with the benefit there being that money belongs to the employee, and 100% of it rolls over from year to year. You can take that with you if you retire from the city. And then that money is always yours to spend with no taxation as long as it's spent on qualified medical, dental, or vision needs. So yes, sir, we're actually out in front of that one as well.
It's great. I don't have anything else.
We try to
Nice
be
job.
we try to be really comprehensive, right, and offer everything that we can get our hands on and for what makes sense for everyone in the organization. As you can imagine, we have entry-level people that are on our plan. We have people that are close to retirement and everything in between. So we have to kind of have that comprehensive look. Yep.
So I guess we could sweeten the pot, and instead of the employees having 0 cost, we could pay, we just have a very, very strong policy. Any questions from anybody in the audience? I'll be anxious to hear how the employees respond. Obviously, that's important to your board. But what I've heard is, I have to say kudos. Thanks for it's obvious you did a ton of work to make this happen. This is also a large line item in our budget, right? Our insurance is over $3 million in premiums, which deserves the amount of time and effort we put into it. So Haley, hats off to you. Charles, thank you. Anybody have any other questions? No?
Mayor, I have one, if you just.
Oh,
one last
Chad,
question.
yes.
The cost out of pocket for like the buy-up plan and for your family, is those gonna be comparable, right? So the out-of-pocket cost, if you're on the buy-up plan today, you pay X amount out of pocket. In addition, are the out-of-pocket costs gonna be similar?
Are you referring to the out-of-pocket maximum on the plan or the premiums you'll pay for the
The
buy-up plan?
premiums, sorry, I should have specified that.
Okay, the total premium will be virtually flat. We're looking at that just over 0.1% if we elect the dental as well. That's where we get that 0.15%. The actual employer contribution versus employee contribution is obviously a board decision. But I would assume that would stay fairly similar, given the fact that our premiums are staying virtually the same.
So Charles, when you say that's a board decision, your recommendation is you go with Cygnus, bundle the vision and dental,
Yes, sir.
right?
Yes, sir.
So what decision would the board be making?
Basically, how to handle that 0.1% or 0.15, that slight increase that you would still get. And do we pass that on to the employee, or do we wash that out with the savings and life insurance and leave the employee contribution the same for the next year? Because the actual billing won't be exactly the same. We're just slightly over 0.1% higher with Cigna than we were with Gravy, given the admin credits.
My experience here says this board, this committee needs to understand that, make the recommendation, because if we took what you just said to the board won't have as much information as we have, and the board tends to follow the lead of the committees that do get into these weeds. So what is this committee's recommendation going to be to the board?
My recommendation to the committee would be, we are at an overall decrease. So it's a small decrease, but it's a decrease. I would say we leave funding the same for employees, because that's just one less thing to change. Even if you're talking about a couple of dollars, it just feels better to realize, hey, I'm not going to pay any more next year than I paid this last year, because that's not happening anywhere else in our lives. So that would be my recommendation.
Okay, so let's emphasize that, right? That this committee understands it, and that was our recommendation to give the board some guidance. You good with that, Kathy?
And when we discuss with the board, I can put some hard numbers to that, right? So they can see the difference in dollars. It's no
Okay.
problem.
On behalf of the employees, we appreciate that.
You good, Chad?
Yeah, thank you.
Okay,
Yeah, that's not happening anywhere else, so that's amazing.
I mean, that affects me. I appreciate that, you know?
yeah.
And our future employees.
Yeah,
That's right.
this person we're recruiting.
Well, I'll tell you, this city has just a remarkable set of employees and staff. And this is one reason, right, that helps us recruit and retain, right? When you're out comparing, yeah.
It's true. And we talk about it a lot in recruiting. I mean, it's a big push, right? That you're gonna have, you could have no cost out of pocket. Prescription savings is huge for people.
You bet.
You know, if you have $100 a month in prescription, that's a big deal. So it is a huge benefit. On top of all the other amazing things we offer, this is just one other piece. But cost savings in your pocket to people, that's really big.
Yeah,
You
for
know,
sure.
When I was looking, I mean, that makes a big difference, right? And what my expectations are in my salary. So it is a huge benefit.
So did I
people are
hear you
blown
say-
away.
Did I hear you say you would take less salary,
Nope.
knowing the benefits that,
I'm perfectly happy where I'm at.
Okay.
It's all working out just perfectly.
just want to clarify. If there's no other questions or comments, we'll go through reports. Anybody have anything they'd like to report? No? You've been awfully quiet. Well, hearing that, I would entertain a motion to adjourn. I thought we did that, but I guess it was informal. So I will entertain a motion for this committee's recommendation to the Board of Aldermen.
I move that we approve Sigma for the 2024 year, the approval to the board,
The bundle?
the bundle.
Mayor, would that be with equal contribution for the employees?
In the mic?
Would that be with an equal contribution for employees in 2024 as well? Because you had mentioned that we need to make that recommendation.
And with an equal contribution to the employees. Thank you for that.
So we've heard the recommendation we're going to make to the board. Is there any discussion? Hearing none, let's vote. All in favor, say aye. Aye. Opposed, same sign. Ayes have it. You want a roll call vote, or is voice vote okay? Voice vote's okay? Again, thank you very,
Thank you.
very much.
Yeah, thank you so much.
Okay. Now, is there any reports? Wow. HR committee meeting lasted 47 minutes. It must be a record. Speed of business. Haley, you're doing great. Thank you. Okay, I entertain a motion to adjourn. We have a motion and a second. All in favor, say aye. Opposed, same sign. Ayes have it. Thank you.